everyone, welcome back to Sholanda's Nursing Corner. If you're a nursing student, you already know pharmacology can feel overwhelming, but don't worry, I'm breaking it down into bite-sized lessons. This is part 1 of our pharmacology series where we'll cover the basics, what pharmacology is, how drugs move through the body, and the key principles every nurse needs to know. Stick around because I have a quick quiz at the end to test your knowledge. Let's get started. Pharmacology is the study of drugs, how they work, how they affect the body, and how we use them to treat patients. As a nurse, you don't just give meds, you need to understand why you're giving them and what effects to watch for. First up, let's talk about pharmacokinetics, which is just a fancy way of saying how drugs move through the body. It happens in 4 steps. 1. Absorption, how the drug enters the bloodstream. 2. Distribution, how it spreads to different parts of the body. Some drugs cross the blood-brain barrier, while others stay in certain tissues. 3. Metabolism, how the liver mostly breaks the drug down so the body can use it properly. 4. Excretion, how the drug leaves the body, usually through the kidneys, urine, or sometimes through bile, sweat, or even the lungs. Fun fact, if a patient has liver or kidney disease, they may have trouble metabolizing or excreting drugs, which means they could build up in the body and cause toxicity. Now let's talk about pharmacodynamics, which is just a big word for how drugs actually work in the body. Most drugs work like a key fitting into a lock, attaching to specific receptors to create an effect. Some drugs activate receptors, agonists, while others block them, antagonists. For example, agonist, albuterol, a bronchodilator, activates beta receptors in the lungs to open airways. Antagonist, beta blockers like metoprolol block beta receptors, slowing the heart rate. As nurses, patient safety is everything when it comes to giving medications. That's why we always follow the 6 rights of medication administration. 1. Right patient, always verify name and date of birth with the medication administration record. 2. Right drug, double check the medication order. 3. Right dose, use correct calculations and check with another nurse if needed. 4. Right route, PO, IV, IM, sub-Q, make sure it's correct. 5. Right time, some meds need to be given exactly on time, like insulin or antibiotics. 6. Right documentation, if you didn't chart it, it didn't happen. All right, let's see how much you remember. I'm going to ask a few quick questions and I'll give you a moment to think before revealing the answer. Ready? Let's go. Question 1. What is the process by which a drug enters the bloodstream? Absorption. Question 2. Which organ is primarily responsible for metabolizing drugs? The liver. Question 3. Which type of drug activates a receptor, agonist, or antagonist? Agonist. Question 4. What are 2 common routes for drug excretion? Urine, kidneys, and bile, liver. That's it for part 1 of our pharmacology series. Next time, we'll dive into drug classifications and the most important meds every nursing student should know. If you found this helpful, don't forget to like this video and subscribe so you don't miss part 2. Thanks for watching, and I'll see you next time on Sholanda's Nursing Corner. Bye for now!